For this next session of the Future of the American Child Journalism Training in Charlotte, we're going to pivot from education to health. And personally, I think understanding the role of Medicaid insurance when we talk about the issue of child health in America is vitally important, particularly since I'm sure all of you have seen the headlines that say Medicaid is evaporating. And I think for 2 million children in America over the past few years, they've lost Medicaid health coverage. So we are privileged today to have as our next speaker, Joan Alker. She is the executive director of the Georgetown Center for Children and Families. And Joan is really going to lead us on a deep dive of what is happening in America in terms of Medicaid insurance for children and what this means for overall health of American children. So Joan, thank you so much for joining us, and please take it away.
Thank you, Rachel. Can everybody hear me okay? Yes. Okay, well then I'll just gonna keep the mask on and I'll remind you you're in the health panel. I've got kind of 3 different segments to what I want to talk about. I'm also really open to folks interrupting me, asking questions as I go. This is a vast topic. I've been working on Medicaid for about 25 years now, and I feel like I'm learning every single day. That's why I love what I do. And that's why I'd love to do what you do. If I wasn't what I was, I think I'd want to be a journalist. So it's just a vast, vast topic. But it is critically important. And I want to start out doing a little bit of background about Medicaid, how it relates to the number of uninsured children, and more broadly, how it relates to our healthcare system. Then I'm going to talk about this major unwinding, we call it, that we're in. And then finally finish up with just some kind of story ideas and ways to think conceptually about Medicaid and children. Okay, so before I get to my first data slide, how many of you have written about Medicaid? Okay, a lot of folks have. It's a big issue, right? It's a big issue for state budgets, and it comes up with respect to budgets in general, but also there's some specific sort of children's angles. Sometimes Medicaid gets pitted against education, for example, even though that's probably, a lot of the same kids are benefiting from both of those budget lines. But Medicaid's role, and I'll say, in the 20 plus years I've been working on it, has become so critical. It's really the backbone of our healthcare system now. It is the #1 payer for long-term care. It's the #1 payer in this country for behavioral health. We have a behavioral health crisis, as you all know, especially for children and adolescents. And it covers about 1/4 of the population in the United States. And it covers half of children. And I don't think most people know that. You know what, I don't see here's my clicker. Okay. So just a kind of data note, the Census Bureau data, and we use census data a lot, undercounts children on Medicaid, quite a lot. And that actually got worse during the pandemic. And I won't diverge into that, but we can come back to that if you want in the Q&A. So we used administrative data, so that's just state data of their enrollment. They all have to report that to the federal government. And so this is kind of the peak of Medicaid enrollment. During the pandemic, states were not allowed to cut anybody off Medicaid. And I'll come back to this. But you can see prior to the pandemic, if you'd used this data source, you would have found 49% of children were on Medicaid. Then over the course of the pandemic, as the numbers went up, it became 54%. I mean, I just think very few people are aware of that. And here we just pulled the top 10 states in terms of, again, looking at the administrative data over the number of children. New Mexico, 3/4 of children are insured through Medicaid. DC, where I live, close to that as well. So on and so forth. A lot of states in the South have a very high proportion of children on Medicaid. But it's, you know, it's absolutely vital for children's health and the providers who serve children. So as I like to say, if you have Medicaid, are all your problems solved? No. However, our system is based on having health insurance, right? That's just like we have a pretty funky, weird healthcare system. And as I like to say, having insurance is the price of admission. You're definitely not going to see a good show if you don't have insurance, and there's plenty of data to back that up. But to even get really in the door to potentially see the show, you got to have health insurance. And first and foremost, Medicaid is health insurance. And I think that's a really important concept. A lot of times, particularly those who are trying to cut Medicaid, denigrate Medicaid, talk about it as welfare, right? It is health insurance. And frankly, at this point, it's a bigger health insurer than Medicare by quite a lot. A lot more people on Medicaid now than Medicare. So this is a situation that we found ourselves in at the peak of the pandemic. But even before the pandemic, like I said, half of children are on Medicaid. Another really important feature about Medicaid is that it's critical for rural areas. And we're going to look at this. This is some data that we put together actually with UNC, has a rural health research center. And the dark counties have higher percentages of people on Medicaid. So we have all of this on our website. But you can see here that when you compare metro counties and small rural counties, these are micro cities under 50,000, especially for children. And this is census, so it's going to undercount. 47% of children in rural areas, 40% in metro, and also bigger for adults, but that's going to depend on if the state has expanded Medicaid under the Affordable Care Act. Quite a few states with large rural populations like Texas and Georgia and Mississippi have not. But so that would be even bigger disparity if those states had expanded Medicaid. And here I just want to talk about, this is a graph showing you the number of uninsured children. And Medicaid started being expanded actually in the 1980s and 90s under President Reagan. Worked out a deal with the Democratic Congress, expanded Medicaid mandatory to all children under poverty. Today that mandatory level is higher, but just to note that it did also start with President Reagan. And eventually the Children's Health Insurance Program was added in 1997, and that was expanded, working together, Medicaid and CHIP. And I'm not going to spend a lot of time on CHIP, but I'm happy to come back to that if folks want. But really, Medicaid covers the vast majority of the children, but CHIP has been a very important piece to that. But particularly after CHIP got expanded and better funded, and Medicaid had some important features added to it as well, around 2009, it started going down even more. And then with the ACA, which was fully implemented in 2014, that had a big drop for children as well. Even though as a general rule, the ACA, this is a good thing, it was needed, was more focused on adults because we were already on a path for children because we had Medicaid and CHIP. But the ACA did help to reduce the number of uninsured children, and also because when you cover their parents, you're more likely to get the kids too. It's like a welcome out effect. So we went down and down, and 2016, as the ACA really rolled out, we got to the lowest number of uninsured children ever, 3.6 million. But then when former President Trump assumed office, we started going back up for a variety of reasons that I won't get into at the moment. About during this time period between 2016 to 2019, about 1 million children lost Medicaid. And you can see the uninsured rate went up. It was about 800,000 children. It's very, very closely correlated. When the number of children on Medicaid goes down, the number of uninsured children is going to go up. So just keep that in your mind. We went down about 1 million in the Trump years, and that equated to a 1 percentage point increase in the rate of uninsured children. So Then we had no data in the pandemic, but then because states were not allowed to cut anybody off Medicaid during the pandemic, the uninsured rate for children started going down again. Now it's going to go back up, and we'll discuss that. So this map is showing you, and I should say we do an annual report on child coverage rates, and this map is always part of it, comes out in the fall. And states that are in dark blue have higher than the national average uninsured children. States in light blue are lower than the national average, and the ones in sort of gray are the national average. And what I think is interesting about this map is that if you overlaid, for example, states that have not done the Medicaid expansion for adults, it's kind of like the South. It's like a lot related to the Confederacy, the old Confederacy and the map. And that's sort of true here, but not exactly. There's a lot more diversity and historically a lot more bipartisan interest in addressing children's health. And so, for example, Alabama, I always point out, has been the star of the South in covering children. They got up to 97% of their children covered. They've gone backwards a little, but Florida is way worse than Alabama. People are always a little shocked there to hear, oh, Alabama did so much better than we did. Even Mississippi has done better than Florida. And Texas is an absolute disaster, but we'll come back to that. But you can see that there's a little more interest in the map here. And you know what I should say, I'm just going to say, because I know you're from Utah. Utah last year passed legislation to cover all children regardless of immigration status, which is pretty amazing. Folks we work with there on the ground, Utah Voices for Children, had been working on that for quite a few years. So it was very, very interesting. So here we want to look at race and ethnicity. And as you might expect, Medicaid, and unfortunately we just really don't have very good data on race and ethnicity in Medicaid. There are efforts to improve that. This is census data looking at uninsured kids, but Medicaid absolutely is of disproportionate importance for families of color. It's important for all children, but it is definitely disproportionately important for children of color. But here you can see who has the highest uninsured rate, and indigenous children by far the highest. Families who identify as Hispanic or Latino, also who can be of any race in this data, have higher uninsured rates, and that's pretty consistent. It's an area where historically Black children have actually done in recent years the same as white children, and that's pretty rare that you see that. That may be going backwards, but we'll have to wait and see for the data. So I put this slide again just to remind you that we had 3.9 million uninsured children as of 2022. Okay, so now we're going to talk about the unwinding, okay, and what's happening right now. So let me just give a little bit of background here. One of the first COVID relief bills, Families First Act, it was called, and it was signed by then President Trump. I like to make that point too, because he did sign this provision into law. As per usual, Congress usually gives states extra money when there's a recession for their Medicaid programs, because Medicaid is a counter-cyclical program. When the economy goes down, Medicaid enrollment goes up. People lose their jobs, more folks are eligible, and so Congress typically increases the federal match rate. I won't diverge into what FMAP is, but it's a federal-state share. Feds pay more than the states. But federal government has, at least since I've been working on Medicaid, they always increase their share. And going along with that, they always have a maintenance of effort, right? Because they don't want to just hand money out to the states and then, the states cut back their Medicaid program and give people tax cuts or pocket the money or whatever. So there's always some kind of maintenance of effort. But in the Families First, because Medicaid is really a first responder to many, many health crises in our society. It was the first responder to the HIV/AIDS epidemic. It was a first responder, 9/11, New York used their Medicaid program. I mean, that's a role that it plays. And we were in a pandemic, so we were in an economic crisis, a health crisis. They kind of turned it to 11, the MOE. That's how I think about it for fans of Spinal Tap. And they didn't allow states, not only can you not cut back eligibility, which has always been the rule, but they literally couldn't disenroll anybody. So normally, they're checking at renewal, right? States do renewal every year. And if your income went up, you lose your coverage. Or if you just don't make it through the process successfully, you lose your coverage. And we're going to come back to that topic. But what's interesting is that when you look at this, what happened in the pandemic, it wasn't so abnormal. Kind of Congress always does this. But because we were in a pandemic, they didn't want people to lose their health insurance. So they turned it up a notch. And they said, states, you cannot disenroll anybody involuntarily. So normally, we have the majority of uninsured children in this country are eligible for Medicaid or CHIP, but they're not currently enrolled, okay? Undocumented children is a tiny, tiny fraction of uninsured children. It's just not a big issue. I think that's what a lot of people think. It's just not true. It's mostly citizen children who are not in Medicaid or CHIP at that particular time. Maybe their family doesn't know they're eligible. Maybe they've been on, but they lost coverage at renewal. They don't know why, or they don't even know they lost coverage. And that all stopped. You know, we call that churning, that kind of red tape losses. All of those issues stopped. And that's why we had this big jump in enrollment. And that's why the number of uninsured children went down. Because as I was discussing, most of these kids are eligible but unenrolled. However, of course, you know, that was not going to stay that way forever. And it was tied to the declaration of the public health emergency when this continuous coverage would end. Congress actually came in the Consolidated Appropriations Act and rejiggered it a little bit so that it wasn't exactly tied to that date. But in March of 2023, states were allowed to disenroll people. And they were they were given 14 months, that's kind of been extended now, to check coverage for everybody on their Medicaid program, okay? So as you know, half of children in the country are on Medicaid. So that's a pretty hefty job to check coverage for all of them when states are A, understaffed, you know, sometimes woefully so. B, some of these families, quite a lot of them have moved, right? There's a lot of residential instability during the pandemic. Low-income families already have higher rates of movement, lots of moving around. There's some states that are extremely politically motivated and being pushed to kick people off as quickly as possible. You certainly won't hear them talking about children, but that's the largest group on Medicaid. This is a process that some families may not have ever been through before, right? New parents, you know, families who moved, different state, different rules. I mean, there's lots of reasons why this process was going to be tough. And we've been pretty worried about it for a long time. We wrote a paper in February 2022 estimating that as many as 6.7 million children could experience a gap in coverage. So that's ginormous, right? Since we had 3.9 million uninsured children last time we checked. We were hoping to be proven wrong, and I still hope to be proven wrong. However, unfortunately, we're literally right on target, which we're shocked because we didn't really know what was going to happen, right? This has never happened before, ever. So we have on our website, we are keeping data for child Medicaid as well as total, everybody on the program. What's the net enrollment change, right? So when you lose your Medicaid, you do have this 90-day period that you can get back on theoretically more easily, you know, or you come back on when you discover it. So we're a lot of the numbers you'll see about Medicaid unwinding is disenrollment numbers flat out. just how many people lost Medicaid. We have that number too, but we're doing a different number. We're doing net Medicaid enrollment change. So we're accounting for when folks are coming back on. And we're doing an aggregation for every state, and we have all of this, and I'll show you some maps. We're taking the month before they started this process, comparing to the most current month we can find. And that's different in a lot of states. Some states, we had 5 states that went right away. We had some states didn't start at all till July, and Oregon just started really a couple months ago. But we're accounting for that. So we're using this baseline that's different for every state, our net number, and as of, you know what, even since I made this slide, it went up. Now that I look at it. I believe we're at 3.5 million now, because we got Texas for November, and Texas is leading the way. So we have a decline of 3.5, I think now, million children on Medicaid. You'll recall that when we lost 1 million, the uninsured rate went up 1%. So this is really a huge deal. And of the children, the data we have so far, the 3.5 million, 40% of them are in Texas and Florida. Texas is a few thousand off of 1 million children themselves. So we only have Texas data through November, so they will clearly be over 1 million by the time we get through 2023. So here, and I encourage you to go to our website. If you go to the tab about unwinding the PHE, you can play with all these maps and look up your state. So this is net total Medicaid enrollment decline. Darker means more. This is percentage, right? So obviously the big states are going to have bigger in total numbers. But again, Texas is really leading the way. Percentage is interesting, right? So then this is in part accounting for when did they start. Like New Hampshire was an early starter, but they really revved up quickly and kicked a lot of people off. And Idaho, Utah is really high percentage too. So that's, okay, sorry, this is child percentage. I'm going the wrong way. Huh. I think you're going to have to help me get back. Okay, here we go. Good, perfect, thank you. Okay, so that's everybody number. That's everybody percentage. No, it's a percentage of their baseline essentially. So for like the states with a high percentage, I think the highest is 31%. So it means like say you had 1 million people on your program before you started unwinding at the end of the continuous coverage period. Now you have 31% fewer people. And then child, again, the big numbers, as I mentioned, Texas. Texas is really, Florida's up to about 400,000+ now, but Texas is closing in on 1 million. And this is child percentage. So this is, you can see, again, speaking, comparing states on percentage terms. But like we have all of this on our website, you can scroll around and look at it. So this is a really big deal. And the piece that's been so kind of, we expected a lot of this to happen, but unfortunately, nationwide, about 70% of these disenrollments are what we call procedural losses. They are not due to a finding of ineligibility. So this is a really big deal. We expected that this would be not a good process, but it's the fact that 70% are procedural terminations is truly terrible news. And we in KFF have those kinds of procedural termination percentage also on our website, so you can see how your states are doing. There are differences, very big differences in procedural terminations. Some states have barely started them. They're really trying not to do them. And some states, again, like Texas, is their rate isn't even the highest, but it's not good. And I'm going to come back to that in a minute. But essentially, you had all these people who were on Medicaid. And some of them undoubtedly got jobs again, right? Because we were in a recession and came off or didn't come off because states couldn't kick them off, but are now on their employer-sponsored coverage, right? So that's okay. But you hear so much about, oh, we're covering all these people and they're not eligible anymore. Well, you don't know that when it's a procedural termination. A procedural termination means that the person or the family did not complete the process. And there's like many, many reasons why that could have happened. And I'll just kind of walk you through the process. So what states are supposed to do is they're supposed to start out by doing what's called an ex parte determination. And an ex parte determination is essentially a state, states have a lot of data, right? They have SNAP data, they have unemployment data, they have wages database, things like that. They are supposed to start the process by checking the data they have, because why would they go, they don't need to go to a family and bother them to prove all these things if the state essentially already knows it, and hello, we're in the, 21st century, whatever we're in, let's use our data, right? So they're supposed to start with the ex parte process and keep families on, if they can, without them having to reprove all these things. So states that have a high ex parte rate are going to do well in this process. Families in those states are going to do well. States that have a really weak ex parte process are not going to do well. And here's where Texas, for example, is doing under 5% of their renewals ex parte, which in my mind means they're not really doing it at all. They're violating the federal law. That's just, I'm not a lawyer, but that's my opinion. States that are doing a lot of ex parte are keeping on a higher percentage of families. So they get through the ex parte process, and let's say that a family fails the process. They then send a form to the family, and the family has to fill out. It's supposed to be pre-populated so that everything they know is in the form. The state knows, and they say, oh, you just fill in the rest of this that we don't know. Family sends it back. The determination is made. Okay, so sounds good, but you can imagine how many millions of things could go wrong in that process, starting with return mail. As we discussed, many families moved. State may not have the right address, right? So that right off the bat is a big issue. Family gets the letter, and it's extremely confusing. The notices are very hard to figure out. I can tell you this is a big issue in Florida. There's litigation actually going on right now in Florida saying the notices are unconstitutional. I do a lot of work in Florida, and this is, how severe this is. I've personally had a couple of families reach out to me, either directly or through reporters actually who are working with them, and they've sent me their notices. And this one family that ABC News profiled, the child had a serious health condition, was clearly going to be eligible. There was 6 notices. I mean, I couldn't figure it out, and obviously I'm a health policy professor. I mean, these notices can be very confusing. They may not be in your right language. Next question is, okay, you got your notice, I need help. I don't understand this, I don't, help. Is the consumer helpline well-staffed? Do they answer calls after hours, right? If you have parents, people working in low-wage jobs, they don't get a lot of breaks. They can't take callbacks. I mean, a lot of these call lines, you call and they put you in a queue and they say, well, I'll call you. The computer says, well, I'll call you back. Well, if you're on a 15-minute break and you get a call back in an hour, that's not going to work for you, right? So lots of questions and problems with consumer assistance. Other problems that have emerged, families upload their documents, but it just doesn't work. Or for whatever reason, the state says, we didn't get that. Or families send their documents back, and the state says, no, you missed your 30-day deadline. The mail got delayed, you didn't get it quick enough, you're off. So there's a million reasons why this process can break down But unfortunately, the procedural termination rates are extremely high. So that is a very big problem. So now I want to talk for a minute about where are people going, okay? We've established a lot of people have lost Medicaid. We've got 3.5 million children. And by the way, the total number is over 8 million for total. Of those 3.5 million are children. So where are they going? Okay, first of all, it's a different question for adults versus children, okay? And this is one thing I really want to stress to you all working on children's issues, is that I know this, I'm sure you all do this already because you work on children's issues, but when you hear elected officials and policymakers talking about something, especially when it comes to health coverage, you have to say, are you talking about the adult or the child? Because a lot of times, children have a different coverage source than their parents, particularly when they're in public coverage. And this, honestly, was just glossed over for like a year. It was really problematic. We'd hear a lot of discussions about unwinding. We're going to do this, this, and this. A lot of focus on the marketplace. You know, understandably so. The Biden administration runs it. It's doing very well. That's terrific. They got the subsidies better. They're putting money in outreach. That's really important for adults, not that important for children. There's just not very many children in the marketplace because the way our public coverage is structured, we have Medicaid for the lowest income kids. We have CHIP sitting on top of Medicaid. And then in some states, the kids on top of CHIP might go in the marketplace. But for adults, it's different. They have Medicaid, or not, if they're in a non-expansion state, and then they have the marketplace. But CHIP is in between Medicaid and private coverage. So it's just different. And so that is a critical issue. So basically, where could these children be going, okay? And also, I should say, before the pandemic started, before the unwinding started, federal researchers estimated that 3/4 of children who are going to lose Medicaid were going to still be eligible, right? So that's why we know a lot of these kids, we know a lot of these kids are still eligible because a lot of kids are eligible for Medicaid. As you all know, a lot of kids are poor. And the eligibility levels for Medicaid and CHIP together, median across the country is 250% of the poverty level. It's high. In some places it's higher, like in Alabama, it's 300%. So it's a lot of children in those income ranges. So basically, children, probably a lot of them who are losing it are still eligible for Medicaid. Hopefully they'll get back on sooner rather than later. The main place, and some of them are going to be going to employer-sponsored coverage, right? I mean, that's the number one place adults are probably going in this process. But as you all know, dependent coverage for low-wage workers is a very different thing than coverage for themselves. It's not very good for themselves, but it's even worse for their children. Affordable dependent coverage. So yet again, when you hear politicians saying, oh, no, my economy is great. All these people are losing Medicaid because they're going in employer coverage because my economy is so great. Okay, well, that's maybe sort of kind of true for the adults, but for the children, different story. Different story. Because dependent coverage, affordable dependent coverage for low-wage workers, very hard to come by. And the kids are probably eligible for Medicaid, or the number one place they were projected to go was CHIP. Now, some states, their CHIP program is Medicaid. States can choose, do they want to expand Medicaid or do they want to have a separate CHIP program? So we call that separate CHIP. So the kids who were in CHIP-funded Medicaid also were protected during this process, and those programs are all integrated. So it's not such a big deal, like California being an example. They don't have a separate CHIP anymore. So those kids are all in one program. They don't have to move from one for another. But a lot of big states, Texas, Florida, and Georgia, and New York, being among them, have separate CHIP. So separate CHIP was kind of the number one place that we thought kids would go if they weren't eligible. So we did an analysis recently just looking at the states that have separate CHIP, comparing the net Medicaid decline in those states, 2.3 million, only 187,000 increase in CHIP enrollment, which is about 10 or 11%. So that's really bad news. Really, really bad news. So this is why, and I have no idea how many people or how many children are becoming uninsured or having a gap in coverage, but if you think back, we're at 3.5 million, and I should say states are about halfway done. So our original estimate of 6.7, if they keep going at that rate, sadly, is right on target. Now, some of those kids are just going to have a short, hopefully, gap and get back on Medicaid. And any gap is a problem, and we'll talk about why. But really, some kids have gone to ESI. Some have probably gone to the marketplace. Again, it's not a huge source of coverage, but some, and we actually should know more about that this week. And then, CHIP was another big place, and not many are going there. So now I'm just going to talk a little bit about some resources for you, and also just, I just took the liberty of thinking about questions for you all to think about, story ideas, that kind of stuff. So we do have on our website, we have this interactive state data hub. You can pick your state. You can get a lot of information about the profile of who's uninsured, what's your Medicaid and your CHIP programs look like, a lot of policy options. Has your state taken those policy options, like how much do they cover immigrant children? Children of lawfully residing status, states can choose whether to lift a 5-year bar. There's lots of things, and we have quality indicators on there too for maternal health, child health, that kind of stuff. So encourage you to check that out. And then the other websites I just want to call your attention to. So MACPAC is a great resource. MACPAC is congressionally, it was federally chartered in legislation. So the commissioners are appointed actually by the GAO. But it's kind of like the official, like MedPAC, right? Isn't that the Medicare one? Now I'm forgetting its name. I think it's MedPAC. MACPAC is like the official, we advise Congress, and they do a lot of great work, and they have a lot of good data. Obviously, KFF, I'm sure you all have heard of, fabulous resource. CMS is the agency that runs Medicaid and Medicare. I'll just note they're very understaffed. And Medicaid.gov is specifically where you go to get CMS information. So I'll just kind of throw out a bunch of ideas. Obviously, we've talked a lot about unwinding, so I'm not gonna talk about that. But so fundamentally, we've covered what role is Medicaid playing for children in your state, what kinds of communities is it most important for, rural versus urban, communities of color, indigenous communities, how much does your state cover children who are not citizens? There are lots of questions about that. How much red tape do families have to jump over? All right, this is an issue we've been working on for years. And as we can see from these procedural terminations, huge, huge issue that are, unfortunately, the way that our country does not invest fundamentally in government, I think, is just reflected in these kinds of inadequate processes and terrible customer service, if you want to think about it that way, particularly for poor families and families of color. And a huge, huge question this fall is going to be how many uninsured children are there? We will get that data in September. And it will not be by any stretch of the imagination a complete rendering of the unwinding, because it'll be 2023. And states were only, some of them hadn't really started, some had, so but it's going to be our first look at how has the uninsured rate changed by state, nationally. If you live or work in a state that is restricting abortion care, how is that impacting the debate about maternal and child health? That has been really interesting, and Medicaid plays almost no role virtually no role in financing abortions. So in that respect, Medicaid, it's just always been prohibited by something called the Hyde Amendment. So Medicaid is not really a payer, and in that sense, the politics are to the side. But to the extent that you have politicians who are saying, oh, we care so much about babies and moms, blah, blah, if they're doing anything for them, they're probably going to have to be using Medicaid, right? And so one example of this is Congress passed a new option to provide 12 months postpartum coverage for any woman or person who gave birth while she or person was enrolled in Medicaid. And they used to be 60 days you get cut off unless you're otherwise eligible. This new option to go to 12 months, 47 states have picked it up in a year and a half, which is a world record. Never, never, never have we seen states pick up an option that quickly. And I think in some of these red states, it's definitely tied to the post-Dobbs politics, where they're trying to look like they're, caring about moms and babies. So that's been very interesting. We've seen Indiana's the state comes to mind. They lifted the 5-year bar for lawfully residing immigrant children and pregnant women last year. Who would have thought that in Indiana? But I think it's tied to the post-Dobbs politics. So that's another interesting bucket. And then the third bucket I want to highlight, and this is another thing we could talk about for a long time. How is care being delivered in your state, right? This is a critical question. You've got to have Medicaid for the price of admission, and Medicaid is extremely protective from a financial perspective. Children have no co-payments in Medicaid, none, not allowed. So it's unquestionable that having Medicaid protects a family financially, and that's where these short gaps in coverage are a big problem. And everybody knows, my kids were little, I have never been to the doctor so much, or the ER for that matter, when one bopped her head on the radiator, cut it open. One trip to the ER, you're in big trouble if you're in a gap. So that's one reason these gaps are so bad. But fundamentally, if we could get to a new day, and I'm going to end on a positive note because I think we are, in some respects, seeing that new day. The question of how care is being delivered, if we could get stability in the coverage, we could start to unpack this question of how is care being delivered, which is absolutely critical. And in most states, care is being delivered by a Medicaid managed care company. Most of you in this room probably Medicaid managed care is delivering the care. That is a system which, in our view, is way under-regulated, not enough transparency about. They're getting, they're getting money to serve a lot of kids and families, and we need to do a lot more to get under the hood of Medicaid managed care and see what's going on in there. So that's a big topic I'd throw out to you. And I'm going to wrap up with my hopeful note. So we talked about the unwinding and how problematic it unfortunately seems to be. The flip side of that, and this is where I guess reflecting a lot of trends in our country, we've got states moving in one direction and states moving in another, right? We're kind of getting to a tale of two states here as a country. We do have a number of states moving forward, we're now in the double digits, to implement a system of continuous eligibility for 0 for infants to age 6. And what that means, and Oregon was the first state to get federal approval, but we have the entire West Coast is moving in this direction, but also even Ohio, a red state, is moving 0 to 3. That means that once that infant gets enrolled in Medicaid, they're covered till they're 6. Don't have to worry about it. Not going to have any gaps in coverage. Parents not going to have to worry about it. And so an idea that we and others had been talking about this idea for 10 or 15 years, and nobody looked at it. But since we sort of lived through continuous coverage during the pandemic, and some states could see, wow, this is really important. It's really important for health equity, because families of color are more likely to churn on and off. And this was a good thing for families, that they didn't have to worry about that. So this is really a breakthrough in the fact that, again, we're over 10 states now who are pursuing this policy. Is really exciting. And about 5 years ago, we put out a policy framework, and very recently Academy of Pediatrics really endorsed this, which is no baby should leave the hospital without coverage, right? So either they go on their parents' employer plan, or you just put them in Medicaid. Stay covered till they're 6, right? Those critical early childhood years. And then you just check their coverage every year when they go to school. Boom, done. We're done with uninsured children. So I do see, I can see that day now. I really can. But that's, I guess, making lemonade out of lemons, because unfortunately, with this unwinding, children are in a heap of trouble. So I'm gonna stop there. We'll do a Q&A.
Let's have a seat here. I always love to have speakers who have optimism, because as a grizzled old journalist myself, and particularly in this year, it can be extremely challenging to think that trends may turn. I'm going to see if there are any questions first, and then maybe start with wait for the microphone, Lois.
I'll talk loud.
No, you need the microphone. We need it to record it.
Okay, sorry. I'm Lois Collins from the Deseret News. You talk about how the notices are very confusing. Is there any indication that that is deliberate in some areas or not?
I will say this. I think it's a tried and true strategy to have more red tape and barriers to enrollment and retention of coverage. And that's honestly in all kinds of states. I mean, that's where we are seeing this new day, but, and we have more protections now than we used to, but like 10 years ago, if a state was trying to tweak their budget, they'd say, let's do more income checks. So again, it's not even that the income has changed, it's that the red tape has gone up. And they make budget assumptions about, if we tweak this rule, more families are gonna fall through the cracks, even if they're still eligible. So notices, what we need is notices have to cover a lot of things, right? Because there's a lot of legal issues there. But we really need notices. It would be great to have a standard mandatory notice that had been tested with people with lived experience. In other words, the people who are going to get the notices and can say if it makes sense to them. That would be in a perfect world.
That was actually going to be my first question, which was, is there a direct correlation between states with conservative leadership and the erosion of Medicaid in general, but certainly for children? And of course, with Texas being at the top of the list, there is at that level, but is it broader than that?
This is where part of the reason I show that map, to show that, there absolutely were red states like Alabama that was really a leader, that had gotten to cover 97% of children. And I mentioned Utah just passed coverage of undocumented children, which I think is amazing. So the politics are not super clear cut, but I think what we've seen in this unwinding is, and this is just another piece that's a little bit confusing, but in those 10 states that have not expanded Medicaid, so they're pretty much all in the South except for, there's Wyoming, I think. But they're pretty much all in the South. Texas, Florida, Georgia, Mississippi, Alabama, Tennessee, South Carolina. Anyway, that's most of them. But because they don't cover adults, mostly, they cover some very poor parents, and they cover people in the pregnant women category, most of their enrollees are children. That's why you saw another part of that paper that we wrote about what percentage of children by state. If you look at enrollment growth during the pandemic, like in Georgia, which doesn't really cover adults, it's mostly children. So in those states, that's who is going to take the brunt of it, by definition, because they don't cover that many adults, if that makes sense. It's going to be new parents, new moms, very poor, mostly women, parents who are falling in the coverage gap because they haven't expanded Medicaid, and then children. So we have seen, I would say, very aggressive efforts to cut Medicaid rolls in Texas, obviously, Arkansas. So Governor Sarah Huckabee Sanders is kind of like the poster woman, I guess you would say, for I'm cutting people off really quickly. Isn't so much talk about children, but it's a lot of children. They have thousands of children who were in the newborn category that had been cut off in Arkansas, and they put the number right out there. It was amazing. But she wrote an op in the Wall Street Journal. I'm getting my program for the truly deserving. These people aren't eligible, blah, blah. So she has been very vocal about it. But, it's not, it falls that way, but it's not completely that way. There are blue states that aren't doing a very good job either.
Well, to that, are there any questions before I jump in again? Let's go over here to Ellie.
With LAist and NPR affiliate in LA. You talked about Medicaid managed care plans, and there's a lot under the hood to be looked at. I mean, what sort of things should we be looking at as it pertains to children's care and children's coverage? Is there any difference in any specific things that are different in how care is being delivered to children? And I guess part of it is also sort of state accountability and state oversight.
Yeah, and there's California is a state where, as you might expect, there's a fair amount of work going on in this area. So children in Medicaid have a benefit package that's called EPSDT. So this is kind of a wonky term, and it stands for Early Periodic Screening, Diagnosis, and Treatment. And this benefit package, interestingly, came to being really because I think it was in the 70s, the military couldn't get enough recruits that were healthy enough. It's pretty wild. Yeah, it's a really interesting article about this. But the benefit package itself is a very good package on paper, right? It's not always good in reality. But the point of it, of early periodic screening, diagnosis, and treatment, is that the children are supposed to get all the recommended screenings that the Academy of Pediatric recommends, and they have this thing called Bright Futures guidelines that kind of lays out what are those recommended screenings. And then if you see a problem, you diagnose it, and then the T is critical, the treatment. So are children being appropriately screened? And for example, for young children, are they getting developmental screenings, which are really important for early intervention? For adolescents, are they having the right mental health screenings? And if are they able to access care, right? So there are lots of questions about that, and there are also questions about intersections with, for example, the child welfare system, right? So all children in the child welfare system are getting their health insurance through Medicaid. And in some states, they're using managed care to deliver that care. Some states they're not. That depends where you live. But that's obviously a group of kids who have really high needs. So what's going on with that? So there's a lot of different ways to approach it, but fundamentally we don't have good data by plan, So to the extent that states are even reporting any data on this, it's not usually by specific plan. So families can't really compare or know which plan is doing a good job. There's not very much transparency about where the money is going, and this is another issue we really like to work on. There's something called a medical loss ratio, And it's sort of required in Medicaid, but it's not really enforceable. It is required in marketplace plans, where they have to spend a certain percentage of the dollar on healthcare services as opposed to administrative and profit taking. So that again varies by state, but let's say you have an MLR of 85%. That means the plan's supposed to spend 85 cents on the dollar actually on care, right? And not returning profit to their shareholder, administrative, lobbying, costs, things like that. So the MLR is something that, again, it varies by state, but I think it's an interesting tool to see if your state has it. Are they enforcing it? Are they getting rebates from the plans if they're, not meeting the MLR, that kind of thing. So we have a lot of papers about these issues. So, but those are a few things that come to mind.
Let's come over here.
Ren Lewis, KREX5. I had an initial question before I go into my actual question, if that's okay. Is it possible for a child to be eligible for Medicaid and not the parent?
100%. Yeah.
Okay.
Yeah. And you know what? I'm really glad you asked that question because I meant to say this. So one of the things that happened in the unwinding, one of the things we've been worried about, as I mentioned, is that because, especially in these non-expansion states, right, like Texas, Florida, and Georgia, the parent's only eligible to 20 or 30% of poverty. I mean, it's super low. And then they're just in a coverage gap because they haven't expanded Medicaid. The child is eligible to at least 200% of poverty. So that's a huge disparity between the child and the parent. And exactly what we were worried about was that the parent might lose, but they think, again, their notice is confusing, whatever, the whole family gets cut off. And so that we call that an unwelcome mat effect. Like when parents and adults get covered, you see a welcome mat effect and children come in. When their parents get covered, that's why Medicaid expansion for adults is good for children, for many reasons, but it's a welcome mat. But we were worried about this unwelcome mat. And over the summer, the Biden administration revealed that there was a glitch. And at least 30 states raised their hand and said they had this glitch. It was self-attesting. Now, I'll just say Texas and Florida and Georgia all said, oh, no, we don't have that. So that was self-attestation. And the glitch was that they were doing the ex parte process that I talked about with a household standard rather than an individualized standard, which exacerbated exactly this problem. Because if the parent wasn't eligible, the whole household was failing the ex parte process. And then they were going to the paper process. And the Biden administration reinstated 500,000 people, mostly children, as a consequence of this. So I'm sorry, because you had another question.
Before you get to your question, I just wanted to do a quick follow-up. If in that scenario a parent is not eligible, does that make it even less likely that they will then take the child? Or do parents more often than not get their children to the care even if they can't get it themselves?
Well, I mean, certainly there's many, many, many children on Medicaid whose parents are not, right? Because it's so many children. But there is data showing that when parents are uninsured themselves, the child's less likely to get care. I mean, it's not, by no means a one-for-one kind of thing, but it's better for the child when the parent has care, right? I mean, not only because there might be confusion about whether the child's eligible, but also think about, postpartum depression. I mean, that is epidemic for poor women, epidemic. And that, inhibits bonding and all these things that are good for the child's health. So there are a lot of ways it's connected, but there's so many children on Medicaid that there's many of them whose parents are not.
Okay. In my area of Colorado, when the unwinding was happening and some children were getting bumped down to CHIP Plus, there was an issue with those children losing access to services for autism, specifically applied behavioral analysis therapy. And I know that the Medicaid buy-in is an option, but I'm just sort of wondering, since there's that kind of gap in coverage between what Medicaid covers and what CHIP does, what someone would be able to do to kind of advocate for those kids to still be able to have access to services under CHIP that they had under Medicaid?
Yeah, that's a really good question. So if they're in a separate CHIP, and we talked about some kids in CHIP are actually in Medicaid, so they get that EPSDT package. So it should be the same. But in a separate CHIP, they could have a skinnier benefits package. So I'm suspecting that's what happened in that case. And that comes down to the state choice about, they could get rid of their separate CHIP and put all those kids in Medicaid, and then they'd all have the same benefit package, but that's really a state choice.
We are near the end of our hour. We'll ask take one more question from Ninoska.
Yes, hi, Ninoska, independent journalist. I just wanted to know, by any chance, you guys have like the list of the states with where the most red tape has been reported, and if anything at all has been done?
Yeah, so that's a great question. We have, every year, along with KFF, we co-author, my colleague Tricia Brooks is the lead author, co-author a 50-state survey of eligibility enrollment policies. So that kind of categorizes, all these different things states could do and which states are doing them, which states are not. So that's a good resource. It's a hard question to answer, but there's two other points I would make. One is, and we don't have recent data on this because of the pandemic, but the Urban Institute does a study on the participation rate. And this is just to kind of explain the concept. So Medicare basically has 99% participation, right? Like everybody knows when you're 65, get Medicare, Medicare.gov. It's just very easy. So we don't have this problem. But Medicaid, and I think this reflects how our country thinks about poor families, there are a lot of federal mandates, right? We've established no cost sharing for children, good benefit package on paper, mandatory coverage to 138, and most states are much higher than that, and they can't really roll it back. But it does depend on where you live, right? And that's where the red tape comes in, and it can be formal policies, or it can be just poor implementation, and not enough caseworkers, they're not following the rules. It can be a combination. I will say one positive thing, and I know we're running out of time, but I'm trying to end on a happy note. So for many years, we talked about the continuous eligibility of 0 to 6, but just even 12 months continuous eligibility is a really important policy that we've pushed for a long time. That means the child gets on, and even if the family's income goes up, they're still eligible for 12 months, right? And so that cuts out a lot of churn right there. That was an option for states, and a lot of things are state options. About half the states had taken in Medicaid, half had taken in a CHIP. Congress mandated that in the Consolidated Appropriations Act. So this has not gotten covered at all. January 1st, 2024, 12-month continuous eligibility was mandated for the entire country for children. So I was just in Georgia a couple weeks ago. They didn't have it at all. And they were like, wow, this is big news. And CMS issued guidance that in CHIP, where a lot of kids have to pay premiums, they don't pay premiums in Medicaid, the premiums are non-enforceable months 2 to 12. So you can charge a child to be eligible an enrollment fee, but you can't kick them off anymore for not paying the premium months 2 to 12. Nobody has covered this, I promise you. And I think some states are probably a little pissed off about it. Plus, we have some new rules coming down. They're going to get rid of some other barriers in CHIP. So there's a lot of action in this area right now because we're in this historic period with this continuous coverage and the unwinding. So anyway, I'm sorry, I just want to follow
up. I'm sorry. So I just want to know, so what you're saying is that basically beginning January 1st of this year, it's mandated that all children are covered by Medicaid, and yet this is not being enforced in certain states?
But just started. It just started a few weeks ago.
Okay.
So it's breaking news. States have to change their rules if they didn't have this.
So
but I don't think a lot of people know about it.
So who's following up on this? Like at a level, at
Hopefully
state
you
level?
guys are. I mean, I will say that the children do all have to go through this renewal process before they can benefit from this new 12-month rule. So it's not going to solve all the problems of all these kids losing on the money, but going forward, it's a new baseline that's mandatory. Plus, as I mentioned, 11, 12 states now are seeking federal waivers or have already gotten a federal waiver to cover the kids continuously from 0 to 6. No questions asked. Some states at 0 to 3 or 0 to 5. Most of them at 0 to 6. So this is where on the red tape, the red tape issue, which has been around for a long time and we've been making slow progress, we're making a lot of progress right now in the policy area, but at the cost of millions of children are right now suffering because of red tape problems. But we're going to get to a better day, at least, everywhere, because we're going to have this 12 months continuous, assuming it's enforced. And in some states, we're going to, I think, really get to a better place.
Well, I was going to ask you to end on a positive note, and so not only did you do that, you issued a challenge to everyone in this room. Go back to your newsrooms, go back to your states, and see what's going on in this regard, and write stories that educate the public. So I'd like to take this opportunity to thank Joan Alker of the Georgetown Center for Children and Families for joining us today. Thank you, Joan.